In Kenya, I think when you say abortion provider, it's not something very positive. Very many people will try and shy away from it.
Over 400,000 abortions are happening in Kenya on an annual basis. We believe majority of them are unsafe.
We are now in a new constitution, and primary health care, basic health care, was widened, and especially issues to do with women. But then when it gets to the people who are formulating the law, it's subject to how they wish to interpret it.
Good morning on this 22nd day of August. If close to 500,000 women in this country who are our mothers, our sisters, our daughters, our nieces, our aunts are procuring abortions and in an unsafe manner, this is something that should concern us.
Mary Stopes focuses on reproductive health globally, but here in Kenya, we focus on family planning services and post-abortion care. We've seen a lot of progress here in Kenya, but the legal context is a bit grey. Under the law of Kenya, a woman can obtain an abortion if it's an emergency. If she's already tried to attempt an abortion, or that she's actually having a spontaneous abortion and she needs medical intervention to complete the procedure. The other condition is the woman's health. And so health can be interpreted very broadly as mental as well as physical health. So it does not allow for a woman to have an elective abortion.
Thank you for calling Mary Stopes. Good morning. Yes, we have a clinic in town. There's this lady who called. She was like very secretive because she didn't want to engage anyone about it. Because even when she was talking to me, she was like, "Are you sure I'm safe talking to you?" I would want to refer you to one of our centers. She was really crying, saying she's been bleeding for 2 days because she had tried like using herbal medicine, and she really needed post-abortion care.
This is one of the commercial areas in Nairobi. There is a very big Somali community around here. It's both Kenyan Somalis and Somalis from Somalia. There's this myth that Muslims, they have a negative attitude towards healthcare maybe, or government provided services and that kind of thing. But from my experience being on the ground, that's not true. We have a range of services, both obstetric and gynecological conditions, deliveries or any emergencies around deliveries, cesarean sections, family planning, and post-abortion care.
As an organisation, we believe that women should be able to choose if, when and how they have a child. We want to support them along that reproductive health lifespan.
Okay, it's okay, it's okay, it's okay. Bladder is empty. In with your nose, out with your mouth. In with your nose, out with your mouth. I don't want the baby to tire here.
We try and make sure that her body is ready and emotionally she's ready, and that she has the right support network to have a happy, healthy family.
Okay. All right. Now the baby is here. Let's go. Good. Baby, clap quickly.
And so when a woman decides this is the right time for her, we are there for her.
There is a lot of unsafe abortion taking place out there. And we receive a lot of cases where the procedure is induced somewhere else. So there is risk of injury to the reproductive system. There is risk of infection. There is risk of bleeding. If someone induced an abortion outside and they came in and despite all the management, the services that were provided, the outcome was still poor. It has a negative impact, of course, on the provider.
Remember, you don't know what crude equipment they might have used to do the unsafe abortion. So you first have to assess external genitalia. Are there any lacerations? After you assess, you now do the bimanual examination. You separate the external genitalia, insert 2 of your fingers, the middle and the index finger. This other hand will be supporting the abdomen from the top.
In the past, it has been that 3 doctors would determine if a woman has the right to have this particular procedure. But now it says a medical provider. Now, that is also in contention. What is a medical provider? We've had some direction from the ministry on that, and a doctor can delegate to a mid-level provider to provide these services. But there's also a lot of anxiety around this.
So in a real client, by this time, any materials that are inside the uterus would now be coming into the syringe. So you will repeat the suctioning until you're satisfied that the uterus is completely empty.
The problem with the law being in a gray area is that it pushes people to seek services in circumstances that are not safe. By the time that client is coming in bleeding or having sepsis because they tried to terminate out there, already society has failed them one time. Post-abortion family planning is something we take very seriously. The family planning is a misnomer. Basically, it's post-abortion contraception. If we let them go without taking care of their contraceptive needs, then we'll have failed them the second time.
Habari zenyu akina mama. Mimi naitwa Rose, tumetoka Mary Stops na tumekuja kupatiana huduma za family planning. Today we're giving long-term family planning methods, the implants and the IUD, and at times we also do the permanent, either tubal ligation and vasectomy. Hiyo dawa imebaki inatoka kwa mwili. Hiyo ndio advantage yake number 1. Number 2, advantage yake ingine, dawa yake ni kidogo. Ina release dawa kidogo kidogo kila siku, either for 3 years ama for 5 years. Our government facilities are overwhelmed, so we have a partnership where we come and offer the same services for free. And we also help out with the workload. We want to maintain a very good, close relationship with them because we really depend on them for continuity of our services. So, ukuna any question about hii implant yenye tunataka kukwekea, maybe concern? At times we do get vasectomy clients. It's not really common. There's a lot of misconceptions around it, mostly revolving around libido. They compare vasectomy to castration. I don't know why. Also, I think the cultural belief, men think that it's the woman's role to family plan, so they're not taking part in that. The women we give services to, most of them are not as empowered. So you'll find that the man decides when they want to have a child, the man decides we're not going to have family planning, because we get women who have come for removal of implants.
Thank you.
And this is what they say, my husband wants a child. So when you ask them, what about you? One of the things we're trying to encourage is women to come with their husbands so that we can educate both of those people on the modern contraceptive methods we have. So when we get a couple, we give them priority. Like last week, we were somewhere in Kasarani, we had around 4 couples. That motivates me, it shows me that we are moving to the next level where men want to be involved in reproductive health. Yeah, when I'm giving my lesson, somebody is actually seeing the visual, so that also helps with understanding. I will remember something I've seen compared to something I've heard. Hello, Antigen Hotline.
Women, even when they call the hotline, would opt to first of all do the procedure on their own. And I think it is because of the stigma. You don't want to be a bad girl, you want to be a good girl, right? You want to be the one who keeps your legs crossed. From past, sex was thought of as creating a family. It can't be for pleasure. But looking at it and just trying to break down those myths is that sex can be for pleasure. I think that's what we advocate for, that you can have pleasure and be safe at the same time. Service providers are coming together and showing that there's a gap in the system. We are coming to fill this gap to reduce maternal mortality in Kenya and actually supporting each other and saying that this is something we need to focus on. So they are actually taking it up, some of them with pride, because they've saved lives.
Thika town is one of the industrial towns in Kenya. The population is young, and so that's what makes the town vibrant. I'm a management plant. At first, I was really concerned about how my friends would look at me and how the community as a whole where I live. What will they think about me? When I go to work and I have a Maristops uniform, what do they say? I really wouldn't speak out easily. My name is Sharon, I work for an NGO. That was it. I attended the workshop where providers come together to share their experiences. I remember during the workshop we were asked how many people are happy or are comfortable working with Maristops. So I guess at that time I was really like, no. So I guess it was self-stigma. So at that time, I really wasn't understanding why. So I was like, no, I'm just working so that I get the salary, period. But the one thing that stood out is what women go through. Every issue is pinned down on a woman, especially reproductive health issues and the choices they have to make. Women are the ones who bear the most responsibilities and the consequences also of their own reproductive health. In case of a failed contraceptive, it's a woman who carries the consequences. In case of also infertility, it's a woman. In reproductive health in Africa, it's all a woman's thing. At bedtime after dinner. After dinner? Yes. Now I wear my uniform from home to here and back and go to town and I'm comfortable. Yes, so I work for marriage stops. Yes. Yeah.
When it comes to whether a woman wants to have a family planning services or safe abortion services, there is absolutely a class issue.
In Kenya, you can access safe abortion services if you have the money. And no one will know about it, and you can go about your day very well. And for the women at a lower social class level, you have to consult, you have to ask people, you have to fundraise. It just becomes this big issue. You don't know where to go. When you go somewhere, someone judges you because you don't have the money.
Because that is the barrier why women would, grind up stones or grind up Guinness bottles and use all kinds of concoctions, that they've made at home. They don't have the same right as a woman who's living in a very nice area in Nairobi where she gets access to contraception, family planning services. If you look at the wealthiest women, most of them have 2, maximum 3 children. How does that happen? And we have areas in Kenya where the only hospitals available to that community are Catholic or religious. That means a woman cannot get family planning services. And our bishops here have got a lot of power. And we've seen it. We've seen examples of this. They've turned many women away, and we've seen the outcomes of that same woman coming in a few, hours later with horrific injuries and so forth. Our society here doesn't give them a voice. They're too stigmatized, they're too afraid to talk about it.
Kibra is the largest slum in Kenya and in sub-Saharan Africa. Apart from the largest slum used to be Soweto in South Africa, but it has been developed and you can't compare it to Kibra. So Kibra is a slum in the sense that most of the people living here are earning below average, less than $1 a day. And apart from that, the housing itself, there are no proper housings around. Most of the houses are either roofed or mud houses. I'm supposed to take care of the clinic during the night. It has been here since 1997, and not a single incident. People are okay with it.
I feel like marriage stops are trying to invite in the young girls. It's a place whereby women want to go. It's clean, even the entrance, it's pretty and it's wide. And also they're trying to make it cost-friendly.
Most clients think that when they are seen getting to marriage stop,
Have a seat.
people will think that they want to have a manual vacuum aspiration done. But the government facility, it's dependent on marriage stop, and especially for family planning. Some service provider may have a negative attitude towards our service delivery, but we find that they are the same individuals who, if they have an immediate relative, will refer that relative to you. So they have that trust with us, but they also have a negative attitude towards us.
Yeah.
Ah, okay.
Then I have a little baby here. A beautiful one.
So you should come there to our facility to get services.
Yeah.
We are offering good services for ladies.
Yeah.
Thank you. Okay.
Yeah.
Okay, thank you. Bye. Yeah.
Some churches, you go, you talk with them, tell them that you want to talk to the congregation about family planning, delivery. You're able to educate them and where they can find the services. And they take it positively, so they give you a chance after the service is over. Yeah.
But not in the Catholic churches.
In Catholic church, they even start to cancel you.
Kosa na jirani anipate, akinipata atanichapa kama mama yangu, tena atanibeba anipeleke kwa mama, tena mueleze nilipata Mary akifanya kitendo fulani.
We had meetings with women in the community through our support groups, and they just started having conversations on positive sexuality and their sexual and reproductive health rights and their sexual lives intertwining with their health. And at that point is where it stemmed out that having an unsafe abortion was something that was normalized by the women in the community. In African society, women are the ones who sacrifice themselves and they say, I'm doing this for my family and I can't be angry, I can't show it to people that maybe I'm offended. So they mask it and you smile. But at some point, it's also good to say that I'm being hurt, this is how I feel, and this needs to be done for me to get from point A to point B, and I need this support. What I mean to be safe is that a woman, she knows everything going into this situation. Also being safe is that afterwards you feel like I'm a whole human being.
For me, the most important thing as I walk out there is to be armed with the truth. Our maternal mortality rate is rising, and it means there's something we are not doing right. And it's probably time to stop, take stock, and really decide which way we want to go.
I think we're going to see an evolution in the power dynamics when it comes to relationships. I think in the past, we've always been restricted when it comes to cultural norms and so forth. The young people, they're challenging that. We're going to see a new Kenya, and that's really exciting.
I'm trying to be the judge of my kind. I'm trying hard to clear up my mind. I'm supposed to be, will never ever be, so let me be my life. Wanna be the judge of my life, of what you don't know, it ain't right. It ain't right. So let me explain it. Yeah.
Before I lay my 16 bars, I think about the many seen stars. Some wish life and others wish scars, but I appreciate that I've come this far. It never used to be this easy. The best out of life comes when you least need.